ഹായ്, ഇന്ന് നമ്മളോടൊപ്പമുള്ളത് ഡോക്ടർ സിൻഡി എം ജോൺ ആണ്. ഡോക്ടർ സിൻഡി എം ജോൺ കഴിഞ്ഞ 13 വർഷമായി കാർഡിയോളജിസ്റ്റായിട്ട് വർക്ക് ചെയ്യുന്നു. ഇന്ന് നമ്മൾ ഡോക്ടർ സിൻഡിയുടെ ക്ലിനിക്ക് ഷുഗർലാൻഡിലുള്ള ക്ലിനിക്കിലാണ്. ഷീ ഹാസ് 2 clinics. She has one clinic at Sugarland, one at Pearland, and the name of the clinic is Vital Vein and Heart. Heart and Vein Clinic. Thank you so much for having here.
Yeah, thank you so much for having me. I'm really excited to be here. I feel really strongly about helping our community, and I'm so excited for this opportunity.
Thank you so much. I know we celebrate February as Valentine's Day and
Yes.
also Heart Month.
Absolutely.
So that wants me to ask, what is the good age to start the cardiac heart screening or the heart health screening?
That's a great question. So I would say it's important to realize that our people are so high risk for heart disease that we are actually in the American Heart Association guidelines as being high risk. So for our people, our community, we should really start our screening at the age of 20.
20 എന്ന് പറയുമ്പോഴത്തേക്ക് ഇറ്റ്സ് വെരി ഏർലിയർ. നമ്മുടെ കമ്മ്യൂണിറ്റിയിൽ നമ്മൾ ആരും പ്രതീക്ഷിക്കാത്ത ഒരു ഏജ് ആണ്. സോ ദർ ഷുഡ് ബി സം റീസൺസ് വൈ യു ആർ ആസ്കിംഗ് ഓർ യു ആർ സജസ്റ്റിംഗ് 20 years because of the risk factors.
Well, it's a couple of things. One, in general, we are 4 times more likely to have heart disease than any other races, which is crazy. And the other horrible thing about it is that we get heart disease much earlier than everyone else. And so it's really important to start screening at the age of 20 so we can identify the patients that are at risk so we can help them earlier on.
Okay. So at risk. So what all are the risk? എന്തൊക്കെ റിസ്കുകളാണ് പറയുന്നത്? I'm sure that because our community has mostly diabetes, blood pressure, so that can be the risk. So what all are the risks you are suggesting?
Really good question. So what's interesting about our people when compared to other people is that we actually have a very different muscle to fat ratio than other races. And so our body composition actually puts us at really high risk. 1 in 5 of our people will have diabetes or insulin resistance. And the other thing is you have to think about the type of foods that we eat. Basically, breakfast, lunch, and dinner is carbs, carbs, carbs. When we eat snacks, it's carbs and it's fried, right? Who doesn't love itigapom? Who doesn't love vada? Who doesn't love all these delicious things? But it's like the worst possible foods you can eat for heart disease. So it's really no surprise that our people specifically tend to have more diabetes, more cholesterol, and we tend to have our blood pressure go undiagnosed or untreated for a long time. And so that's why we really want to start screening people much earlier on.
So ഒരിക്കൽ സ്ക്രീൻ ചെയ്ത once we have a good screening, how long that screening is good for?
So I would say the best way to do it is when you get your regular physicals with your primary care, and all of us should have a good primary care and go to our physicals regularly. We should be keeping an eye on our blood pressure, and we should really know our numbers. So we should know what our cholesterol levels are. Do we have diabetes? What is our hemoglobin A1C? But the other thing is really knowing also what your family history is. Did your mom have a heart problem, dad have a heart problem, brothers, sisters, any of those things. And then once we do these general screenings, we can start weeding out, okay, these are the people that are high risk, and these are the general population. And once we figure out who those high risk patients are, people with a strong family history, people with diabetes, people with bad cholesterol, that's really when they should get grouped in and say, okay, time to go see the cardiologist. And then you get to meet somebody like me and we start talking about, okay, what do we need to be looking out for? And what can I do to help you now in terms of prevention and diagnosing disease early on so that we can avoid these problems that happen later on in life?
Yes. So ഇതിൽ നിന്ന് തന്നെ എനിക്ക് കേൾക്കാൻ പറ്റുന്നത് you are very passionate about educating our community.
Absolutely.
Because കാരണം to be honest, our South Asian population is very prone to heart diseases, very prone to diabetes, very prone to blood pressure issues. So when you have patients like this, എന്താണ് the challenges you face?
So I think one of the funny things that I noticed about our community is we are by far the best community on the planet. We have the best food on the planet. We have the most educated, most successful people there are, right? But we don't want to be sick. And so we don't want to accept that we have certain medical problems. So when you go to your primary care and they say, oh, you know, blood pressure is a little bit high, cholesterol is a little bit high, we say, okay, corporal, nobody, I'll just wait and see. You know, we'll take it next time, doctor. Don't worry about it. Don't put any medicine there. But what's crazy is we're missing these opportunities to start treating these problems early on. So one of the challenges is knowing what we're at risk for and actually being proactive about identifying these diseases that we may have and start treatment early. And the second challenge I find is that we're not very straightforward when we communicate with our doctors about the symptoms that we're having.
Symptoms, yes.
And that's something that I really want to make sure that we're working on as a community, because I may have a Malayali patient and they may say, I may ask them, you know, do you have any chest pain? And they'll say, oh, chest pain, something. And if you say that to an American doctor, they'll say, okay, no chest pain.
Yes.
Right? But you say that to me and I go, what is this something, what does that mean? You know?
Right.
And then I start asking more questions. And then they'll say, oh, you know, when I go up the steps, sometimes I just get you know, like I get a little short of breath, I get a little pressure in my chest. And then I start digging and I go, okay, that's not normal, right? But it's about knowing that as a community we're high risk and learning how to communicate when we have these symptoms so that we can get the help we need in a timely fashion. I think that's really critical for our listeners to know.
So I will thinking, our listeners are very fortunate because Cindy knows Malayalam. Cindy Malayalam അറിയാം നമ്മുടെ കാരണം കൂടുതലും നമ്മൾ സിംറ്റംസിനെ ഹൈഡ് ചെയ്യാനാണ് ശ്രമിക്കാറുള്ളത്. അല്ലെങ്കിൽ നമ്മൾ സിംറ്റംസ് ഓക്കെ ആണ്, അത് ജസ്റ്റ് ഒരു ചെസ്റ്റ് പെയിൻ അല്ലെങ്കിൽ ഒരു ഗ്യാസ് പ്രോബ്ലം ആണെന്ന് പറയുന്നത്. സോ ഹിയർ വി ഹാവ് എ ഡോക്ടർ ഹു നോസ് മലയാളം. മലയാളത്തിൽ പറഞ്ഞാൽ മനസ്സിലാവും, മലയാളത്തിൽ നിങ്ങളുടെ സിംറ്റംസ് പറഞ്ഞാൽ മനസ്സിലാവും. അപ്പം സോ വി ഹാവ് ടു ഗെറ്റ് ഹെൽപ്പ്, റൈറ്റ്? അപ്പൊ അതിന്റെ കൂടെ സൈൻസ് ആൻഡ് സിംറ്റംസ് പറഞ്ഞു, ചെസ്റ്റ് പെയിൻ പറഞ്ഞു, ഷോർട്ട് ഓഫ് ബ്രെത്ത് പറഞ്ഞു. Then what other signs and symptoms we have to watch out for?
Really good question. So if you read a medical textbook, it's going to say chest pain, but there's so many other symptoms that go along with chest pain. So there's chest pain, there's pressure, like someone is sitting on your chest. Yes. There's squeezing, tightness, especially around the bra area. My female patients, they usually tell me that. Sometimes it could be just a burning sensation, and people will say, chamada gas, it's just acid reflux, something like that. Sometimes my patients will complain of nausea, sweating, shortness of breath, sometimes numbness that goes down the arm or to the neck. I had a young lady, another Malayali lady actually came in to see me, and she only had back pain. Okay. Imagine just some back pain that she was having, but she just wasn't feeling good. But see, those are the things we need to communicate very clearly when we go to get screened. Because if a regular healthy 20-year-old person of another race says, I have some chest pain, I go, okay, maybe it's nothing. We'll do some tests. When a Malayali patient tells me if they're 20, 30, whatever, they'll say, nope, we're going to do this, because we are so high risk. We really need to be aggressively screening our people.
Exactly. Yeah. Exactly. Yeah. Especially, like, since you said, like, especially നമ്മുടെ സ്ത്രീകൾ the hide ചെയ്യാൻ ശ്രമിക്കാറുണ്ട്. So that's good. You are giving this information to us. So already നമ്മൾ സ്ക്രീനിങ്ങിനെ പറഞ്ഞു, even there is some history, we have to start early screening by the age of 20. And since I come from a pediatric background, I would say, like, especially like activities ഒക്കെ ചെയ്യുന്നതിന് മുന്നേ go for a routine physical examination. So we talked about the signs and symptoms. We talked about the screening. Now, നമ്മൾ ഹൈ റിസ്ക് ആണ് നമ്മൾ ഓൾറെഡി അറിഞ്ഞു, നമുക്ക് ഫാമിലി ഹിസ്റ്ററി ഉണ്ടെന്ന് അറിഞ്ഞു. പക്ഷെ ഇപ്പം നമുക്ക് അസുഖങ്ങളൊന്നുമില്ല. But do we have any preventative measures or preventative things, or what can we do?
Absolutely. Really good question. Can I add one point onto what we were saying about those symptoms? And I apologize for going off topic, but sometimes another thing that can happen that we ignore is we get chest pain or pressure when we get upset. And people don't realize that it's the same thing as having chest pain or pressure when we walk or go up the steps. And so we ignore that. So I really want to make sure that we all know that it is never normal to have chest pain, pressure, squeezing, or tightness in your chest. It doesn't matter if you're exerting yourself or even if you're just upset. That's a great reason to go see your friendly cardiologist. And then you were asking me, and sorry to go off topic again, but about what are the things that we can do? You're right. We're genetically predisposed to heart disease. We get it, right? We got to go to our physicals. We got to know what we're at risk for, take the right medications. But what can we do about that now?
No.
Two things. One, think about the foods that you're eating. Does it really make sense to have idli, dosha, appam for breakfast, and then chapati for lunch, and then chor for dinner, and then chai with sugar, and then all these snacks every day? Is that really the right choice? And then secondly, are we moving? Are we exercising? We eat dinner like 8 o'clock, 9 o'clock, and then what do? We sit on the couch, read the newspaper, watch the serials, and then go to sleep. What we need to do is we need to walk. We need to get active. We need to be walking every day about 30 minutes, 5 times a week. You can enjoy the weekend and take some time off, but we really just need, as a community, to be more proactive about these things because our people are dying at surprisingly young ages and at very fast rates. We all know people who've suffered from heart disease in our community, and it's absolutely heartbreaking, but we can do something about it.
That's true. Like even though we work out 5 days a week, we have things in the weekend like a kalyanam.
Yeah, exactly. Absolutely. Yeah.
So we are about to wind up our session.
Yeah.
So it was a really motivating conversation, even for me and myself, because I have family history.
Yeah.
I know most of our listeners have family
Absolutely,
history.
yeah.
And even though if you don't have a family history, your heart is very important.
Yeah.
Your heart, and we don't want to break it or hurt it, right?
Right.
So can I have a takeaway message for my listeners and my viewers?
Absolutely. I would say there's only one of you, okay? And your family needs you. So we need to do everything we can to make you a priority, figure out if you're at risk for heart disease, and do everything we possibly can to protect you and make changes so that you can help your family do better. Because we've got to think about our future generations too.
Thank you so much, Dr. Cindy.
No problem.
So, Dr. Cindyയുടെ ലൊക്കേഷൻസ് ഷുഗർലാൻഡിലും പെയർലാൻഡിലുമാണ്. ഞങ്ങളുടെ ഈ വീഡിയോയുടെ അവസാനം ഞങ്ങൾ അതിൻ്റെ ഡീറ്റെയിൽസ് കൊടുക്കുന്നതായിരിക്കും. They accept all type of insurance and they don't have that much waiting time for getting consultation. So that is the other thing. നമുക്ക് ഇവിടെ കൺസൾട്ടേഷൻ കിട്ടാൻ ഭയങ്കര ബുദ്ധിമുട്ടാണ്. പക്ഷേ ഇവിടെ ഡോക്ടർ സിൻഡിയുടെ ഓഫീസിൽ if you can call or if you have the referral, you can get the appointments easily and they take all the insurance except Medicaid. So we will share all the details along with our video. So thank you so much for your time. മറ്റൊരു ടോപ്പിക്കുമായിട്ട് അടുത്ത പ്രാവശ്യം കാണുന്നവരെ നന്ദി, നമസ്കാരം.
Thank you.